there have also been threats to individual Catholics. Generally, healthcare providers have been asked to violate their beliefs, specifically relating to assisting in abortions and providing abortifacient drugs. In Washington State, in 2007, the Washington State Board of Pharmacy passed new regulations making it illegal to refer patients to neighboring pharmacies for reasons of conscience. So if they came in, for example, for Plan B, morning after pill type thing, instead of saying, I can't provide that for you, I'm sorry, but here's the pharmacy across the street where you could go, Washington State said, no, you pharmacist, even though you're a Catholic and you're opposed to this, you have to provide this yourself. The law, though, even though it didn't include a conscience protection, you could refer somebody across the street for a variety of other reasons, business reasons, economic reasons, or simply reasons of convenience. We're out of stock on Plan B. You need to go across the street. We don't stock that because it's not profitable. You need to go across the street. But if you're opposed to it for religious reasons, you were just kind of out of luck. A family-owned pharmacy and 2 individual pharmacists sued to challenge the law. One of the pharmacists had been fired from her job, one had been transferred to another state, and the family-owned pharmacy had been repeatedly threatened and investigated by the pharmacy board. The interesting thing about this Washington State case is that these regulations specifically targeted religious believers. The pharmacy board that imposed the regulations had previously voted unanimously to include a conscience protection clause for pharmacists. But when Washington's governor found out that they were trying to include conscience protections, she publicly threatened to fire the board's members. She replaced several board members with candidates who'd been screened and approved by Planned Parenthood, and she personally joined in a boycott of the family-owned pharmacy that ultimately brought this lawsuit. Thankfully, the pharmacists recently won their case. The case was brought by the Becket Fund, and a federal district court struck down the law on religious freedom grounds. Last year, a group of 12 nurses in New Jersey at the University of Medicine and Dentistry in New Jersey had to sue their hospital after it instituted a new policy that would have required them to assist abortion patients before and after the actual abortion procedure. Thankfully, they successfully settled their lawsuit, and the hospital agreed not to force them to assist in any way except where there's a genuine medical emergency and no one else is available. Then they do have to go in and assist briefly until someone who doesn't have a conscious objection can make it in. What's interesting about the New Jersey nurses case, though, is that the hospital claimed it wasn't violating their conscience rights. It said in a statement that no nurse is compelled to have direct involvement in and or attendance in the room at the time of a procedure to which he or she objects based on his or her cultural values, ethics, and or religious beliefs. So we're not doing anything wrong here. But this is just another example of someone attempting to tell Catholics and other believers what our faith requires. We've seen this with President Obama's proposed compromise on the HHS mandate that Kim talked about. He claims that his accounting gimmick should be sufficient to placate Catholics because our institutions will pay for contraceptives, sterilizations, and abortion-inducing drugs indirectly through our insurance premiums rather than directly. This New Jersey hospital told its nurses that their faith only required that they not actually participate in the abortion. It was fine if they helped out before and after it happened. And one manager shockingly told one of the nurses, "You just have to catch the baby's head. Don't worry, it's already dead." The government and other entities trying to tell us what our faith requires of us seems to me to be the height of arrogance. It should be up to religious institutions and believers, not government institutions or anyone else, to define what we believe.